had no relevant conflicts of interest to report. This report favors industry-friendly assertions over evidence. It supports the treatment of chronic opioids despite no evidence supporting efficacy and substantial supporting harm. It opposes limits on duration dose of opioids despite evidence of increased harm and increased dose and duration of use. Risks of addiction and death are minimized. Alarmingly, the report backs the improving use of opioids and benzodiazepines, a practice that dramatically increases the risk of fatal overdose. This report implies wrongly that the respiratory depression occurs only with illicit, not prescribed opioids. In fact, all opioids cause respiratory depression and death. There is the appearance of industry bias in the formulation of the report. There are many conflicts of interest. Committee members are paid directly or indirectly by opioid manufacturers. This is absolutely unacceptable. The report continually contradicts and undermines the CDC guidelines by invoking opinion pieces and anecdotes rather than data. The report promotes, without evidence, the use of opioid therapy for chronic non-cancer pain. There is no evidence that opioid therapy is benefiting in the treatment of this type of pain, substantial evidence demonstrating its harms. It is asserted that the misapplication of the CDC guidelines has driven pain patients to suicide and street drugs. There are no data to support this statement. In fact, higher doses of opioids have been linked to higher rate of suicide. Regarding illicit opioid use, most patients who turn to illicit drugs first began with using prescription opioids. This report appears to be part of an industry-driven effort to attack the CDC guideline using not evidence or fact-based arguments but anecdote and opinion. The intent of the CDC guideline is not, as stated in the draft, to broadly reduce the amount of opioids prescribed for treating pain, but to reduce irrational, unnecessary, and dangerous prescriptions of opioids to improve the health of the country. Altogether, the report produced by the task force fosters opioid overprescribing. Its refusal to back dose and duration limits essentially provides physicians unlimited license for irrational prescribing. Evidence is not optional when assessing the benefits and harms of any therapy. This task force needs to be reassembled with experts with no conflicts of interest. This report needs to be revamped. Anything less will foster rather than mitigate the opioid epidemic. Thank you for your time and attention.
Thank you.